Great day, grade 4 student. Welcome to our scientific day with Miss Shar. Let me read our learning targets for today. I can describe the main function and identify the causes and treatment of diseases of the lungs. I can practice habits to maintain a healthy lungs. Look at the lungs. To locate those lungs. Your lungs allow you to take in fresh air, get rid of stale air, and even talk. Let's take a tour of the lungs. Your lungs are in your chest and are so big that they take up most of the space in there. You have two lungs, but they aren't the same size the way your eyes or nostrils are. Instead, the lung on the left side of your body is a bit smaller than the lung on the right. This extra space on the left leaves room for your heart. The lungs. A look inside the lungs. From the outside, lungs are pink and a bit squishy like a sponge, but the inside contains the real lowdown on the lungs. The main function of the lungs is to combine oxygen with the blood and to eliminate carbon dioxide from the body. Now let's look at the inside of our lungs. At the bottom of the trachea or windpipe, there are two large tubes. These tubes are called the main stem bronchi, and one heads left into the left lung while the other heads right into the right lung. Each main stem bronchus, the name for just one of the bronchi, then branches off into tubes or bronchi that get smaller and even smaller still, like branches on a big tree. The tiniest tubes are called bronchioles, and there are about 30,000 of them in each lung. Each bronchiole is about the same thickness as a hair. How do we breathe? The mechanics of breathing. There are two processes. When the lungs inhale, the diaphragm contracts and pulls downward. So we have inhale or inspiration. At the same time, the muscle between the ribs contract and pull upward. This increases the size of the thoracic cavity and decreases the pressure inside. As a result, air rushes in and fills the lung. As you breathe in, your diaphragm contracts and flattens out. This allows it to move down, so your lungs have more room to grow larger as they fill up with air. And the diaphragm isn't the only part that gives your lungs the room they need. Your rib muscles also lift the ribs up and outward to give the lungs more space. So when you are inhaling, the diaphragm flattens or moves downward while the ribs flare in outward direction. What you can see in the picture is the alveoli. The air finally ends up in the 600 million alveoli as these millions of alveoli fill up with air. The lungs gets bigger. It's the alveoli that allow oxygen from the air to pass into your blood. All the cells in the body needs oxygen every minute of the day. Oxygen passes through the walls of each alveolus into the tiny capillaries that surround it. The oxygen enters the blood in the tiny capillaries, hitching a ride on red blood cells and traveling through layers of blood vessels to the heart. The heart then sends the oxygenated or blood filled with oxygen blood out to all the cells in the body. Another process or another mechanics of breathing is exhalation or exhale. expiration. So we have inhale, exhale, inspiration, expiration. So it happens when the diaphragm relaxes. When the air lifts and the lungs spring back to its original position, like balloons, the lungs require enough energy to blow up. So by now, your cells have used the oxygen they need, and your blood is carrying carbon dioxide and other wastes that must leave your body. The blood comes back through the capillaries and the waste enter the alveoli. Then you breathe them out in the reverse order of how they came in. The air goes through the bronchioles, out the bronchi, out the trachea, and finally out through your mouth and nose. The air that you breathe out not only contains waste and carbon dioxide, but it's warm too. As air travels through your body, it picks up heat along the way. You can feel this heat by putting your hand in front of your mouth or nose as you breathe out. Look at the picture. What can you see? Right. Grandpa is having a hard time going up. What can be the organ that could be badly affected when you are having a hard time breathing or going up? We call it a shortness of breath. This is an uncomfortable condition that makes it difficult to get air into your lungs. Problems with your heart and lungs can harm your breathing. Some people may experience shortness of breath suddenly for short periods. Others may experience it over the long term, several weeks or more. So the organ that is affected here, if you are having a hard time going up the stair, is your lungs or your heart. So what conditions and disorders affect your lungs? Let's talk about the diseases of the lungs. First, let's look at this picture. Have you experienced an allergy? These are allergies. Allergic reaction could be skin contact by poison plant, animal scratches, or pollen or latex, or it could be by injection or bee sting, or ingestion through medication or nuts and shellfish. You can have allergic reaction also through inhalation. So when you inhale pollen or dust, mold and mildew, animal dander. Yan. So allergies are usually caused by infections or any type of pollution that can trigger asthma symptoms. Common allergens include drugs, dust, food, molds, pollen, pet, and animal fur, and reaction to sudden changes in weather temperature. Severe allergic reactions need to be treated with medication at once. Allergy shots may also be given. Another diseases of the lung is asthma. You will have difficulty breathing. This is a condition wherein the airways are inflamed, causing wheezing and shortness of breath. Common asthma is triggered by animals, dust, mites, certain medicines, molds, pollen, changes in weather, respiratory infections, strong emotions such as stress, food intake, and tobacco smoke. Among the treatments are giving of quick relief medicines and long-term medicine. Avoiding triggers or substances that irritate the airways will also be beneficial to prevent asthma attacks. You take most asthma medicines by breathing them in using an inhaler or nebulizer. The next one is tuberculosis, one of the most fatal respiratory problems. It is caused by a bacterial infection that mainly affects the lungs. The bacteria that cause tuberculosis spread from one person to the other through tiny droplets released to the air through coughs and sneeze. The next lung disease is chronic obstructive pulmonary disease, or COPD. Look at the picture. Compare the normal air sacs and the air sacs with emphysema. COPD is a condition characterized by the inability to exhale normally, which results to difficulty in breathing. COPD cannot be cured but can be treated by avoiding tobacco smoke and air pollution, engaging in sports and proper exercise, eating regularly, observing proper diet, and taking enough rest. We usually hear the word pneumonia. So pneumonia usually starts when you breathe the germs into your lungs. You are most likely to acquire this disease after having a cold or flu, especially if it is not treated properly. Most cases of pneumonia are caused by bacteria called Streptococcus pneumonia, present in the mouth, nose, and throat, entering the lungs. Most cases of pneumonia can be treated at home with antibiotics as prescribed by the attending doctor. However, severe pneumonia may be well treated as the patient is admitted to the hospital for treatment. Vaccination will also help a lot. Now look what we have here. We have a healthy bronchial tube. And then we have inflamed bronchial tube. So this disease is called chronic bronchitis. This is an inflammation of the bronchial tubes that causes cough with mucus, shortness of breath, wheezing, and chest tightness for a long period of time or sometimes chronically. Cigarette smoking is the main cause of chronic bronchitis. Air pollution, infections, allergies, and secondhand smoke may also cause chronic bronchitis. Experts say that there is no cure for chronic bronchitis. The treatment given is for the prevention of complication and avoiding other respiratory irritants. How can you keep your lungs healthy? Don't take your lungs for granted. They are essential for life, even if you don't think about them. That's why it is crucial to prioritize your lung health. This helpful recommendation can help you breathe easier and keep your lungs healthy. Smoking is the #1 cause of lung disease and contributes strongly to COPD and lung cancer. So no to smoking. Smoking causes chronic inflammation in the lungs that can make breathing more difficult and destroys lung tissue. If you are a non-smoker, don't start smoking. If you smoke, talk to your doctor about smoking cessation aids. Cessation means desire that can help you quit. So since you are only grade 4 student, no to smoking. No. Exercise strengthens your lungs and boosts your immune system to help you ward off infections such as pneumonia and bronchitis. Certain exercises can also strengthen your diaphragm and the muscles between your ribs that help you breathe. Combine cardio exercises such as running, walking, and swimming with strength training exercises to strengthen your lungs and breathing muscles. Indoor and outdoor air pollutants such as secondhand smoke and vehicle exhaust can cause or worsen lungs problems. So avoid exposure to air pollutants. Take steps to make sure you and your family are breathing in as much clean air as possible, such as testing your home regularly for radon and taking walks away from busy roads that expose you to large volumes of vehicle exhaust. So your lungs make oxygen available to your body and remove other gases such as carbon dioxide from your body. This process takes place 12 to 20 times per minute. When you inhale through your nose or mouth, air travels down your pharynx, passes through your larynx, and into your trachea. So interesting facts about your lungs. You can have lobes of your lung removed and live. You can even live with only one lung. Lungs are the only organs in your body that will float. Exercise can help you increase your lung capacity. A typical adult has 300 million to 500 million alveoli. So that's all for today about lungs. Another scientific day with Miss Shad. Stay happy, thank you, and stay safe. Bye-bye everyone. I love you.